USA, they would like you to come to the hospital and you not be able to do things for yourself. Most people don't realise this until they get sick. You want the doctor to take care of you. But actually, in reality, it becomes you. The doctors all know about a little bit of you. There's only one person who knows about all of you. That's you.
Mohammad Al-Ubaydli, he's the CEO and founder of the Patients Know Best, a free digital platform that lets patients securely access, manage, and share their medical records. With 4.2 million users and 100,000 more joining each month, it empowers patients to take control of their health and supports personalized care.
Why is it so crucial for patients to keep their own medical data records?
It's about a person being able to live healthy for longer.
Welcome to How Many Zeros, Mohammed. So nice to have you here.
It's a pleasure.
Can you please give us an overview of the core service that Patient Knows Best offers?
Sure. It's a personal health record about your life that goes with you throughout your life, from birth to every stage of health and disease. And it travels with you wherever you go in the world and accumulates data from everyone looking after you, including you, the person who ends up affecting your healthcare the most.
Why is it so crucial for patients to keep their own medical data records, and how does Patient Know Best facilitate this?
Most people don't realise this until they get sick. When you're sick, you want the doctor to take care of you. But actually, in reality, it becomes you. The doctors you speak to all know about a little bit of you. And there's only one person who knows about all of you. That's you. But you don't have the tools to do that. And so that's what a personal health record is for.
Because I've seen some comments users online as saying they encounter many medical terms that they are not commonly used in day-to-day life. However, the final record is going to be found on Patient Know Best, so which is okay if they don't understand them on the spot.
Yes. Even if you don't understand the information, the fact that you have it means that you can deliver it to somebody who does understand it. But I find often over time, the patient themselves does begin to understand the information.
Yeah.
It's not because they went to medical school. It's not because they're scientifically trained. It's just they have time and they have the disease. And so they start learning. The meaning of the words really matters to their day-to-day life and experience.
How much does your service cost for each patient?
It's free of charge for any patient.
Really?
Yes. We normally offer it to either a healthcare provider like a hospital or a regional government. And the reason those people pay for it is when the patient has their day-to-day cheaper to look after. So the hospital becomes more efficient, the government becomes more efficient. And so they fund it once for their population and the patients get it free of charge.
But isn't it more beneficial if the patient does not have their medical records? They can go to the hospital and the hospital can ask them to do the examinations or test again, where they can make more money out of it.
That's a very good point.
Yeah.
The reason I did my research in the USA but started the company in the UK is that in the USA there was that conflict. So they would like you to come to the hospital and to not be able to do things for yourself. Whereas the UK in particular and government-funded organisations in general, they have a fixed budget and almost unlimited demand. So for them, the person being able to look after themselves is necessary. And it becomes even more necessary as people age and budgets shrink.
What role is the national health system is playing in this situation?
When we started, everyone assumed that they wouldn't do this. They said, the NHS is not consumer focused. It's not true. In every system, there are doctors who want to help their patients. The difference is financial incentives. And in the NHS, they're not trying to lock the data in, to lock the customer in. And anything that allows them to work more efficiently, they are happy with, because efficiency is what they need. In private systems, revenues is what they need. And it's okay if it's inefficient as long as you have a margin. In publicly funded systems, it's about efficiency and quality.
So they're being more open.
Yes. Well, I'll give you a very concrete example. So if you look at COVID, for example, during COVID, every government in the world became more involved in citizens' healthcare and they collected a lot more data. But nobody released data to the citizen except the NHS. The NHS released more data than any other country and certainly more than anyone expected. So the NHS has a culture of empowering the individual.
So they just keep the data for themselves, and as patients, we don't know what they're going to use this data for.
So that's the traditional healthcare practice, is that the data is kept with the doctor. 100 years ago, when you see the doctor, they write notes about you and they lock it in their cabinet. It's because your record effectively is their income. It's only later that you got things like the Mayo Clinic, where they began sharing data between different doctors for quality. And now you have government-funded healthcare systems in Sweden, in Denmark, in the UK. They are built on a culture of transparency. And so they tend to release data more.
Yeah. And as a patient, so what's the difference with a patient with the patient knows best and who has not a patient knows best? What's the difference they're going to encounter?
A person who has their information and patients know best is more prepared.
Yeah.
So before they come to the appointment, they know what test results they have. They don't know, that's also useful because they can come to the doctor and say, what does this word mean? What does it mean that my result is high? What do I need to do, doctor? A person who doesn't have that information and they think of their questions after they leave the appointment.
Yeah.
So you've wasted the appointment.
I see.
So having your information beforehand, you bring some understanding, you bring your questions, you come prepared, and you make the most use of that time with the doctor.
Right. And the market of the electronic medical records financial revenue was valued at approximately $32 billion in 2024, and it's expected to reach 46 billion USD by 2031. So do you think letting the patients to keep their medical record would eventually grow and boost the market for electronic medical even more? And if so, why the people in the US still seeing it as a threat instead of embracing it?
That's a very good question. Okay, so first of all, yes, it will grow the market. But I would like to clarify, most of the products that are called electronic medical records are actually electronic billing records. So the US healthcare system spends billions on medical records only because they can generate bills more quickly, more easily. And the reason the US healthcare systems hold on to the medical record is it means they can control their bills. In publicly funded systems, they don't care about that, and so they'll release the actual medical record. Now, it is my belief that over time, the only party with the medical record is the patient. So as they go to different doctors, they get a copy of everything. And then when you add the devices, so your smartphone is collecting things that no current medical record can store. So my Fitbit has my sleep patterns for 6 months. My father has Parkinson's. Your phone can tell your movement changes as you walk years before your neurologist can tell. Your phone can tell changes in your voice for Parkinson's years before your doctor can detect them. So these phones are monitoring diagnostic devices that can collect data. So that will become the medical record, and the billing record will have to connect to it rather than being something that controls their access to the data.
Is it achievable via patient knows best?
Yes.
How?
That was the whole idea behind the system in the beginning. So the original vision that we had for it was that record would receive data from all the doctors and nurses. So all their internal systems would send a copy of what they had.
Yeah.
But it will also receive data from your phone, from your Fitbit, from all kinds of new devices. So we built the architecture to store all of that data at very large scale and for a whole lifetime.
But in the financial perspective, how it will eventually boost the market?
When you look at the health of the population, and honestly, it's the financial survival of a country, because every country is now struggling on how to afford healthcare for its citizenship.
Yeah.
So it's a really important decision to be efficient in making sure that everyone gets healthcare. So if you're doing that, the billing systems are not useful. What you need is the health systems, their personal health record that understands what's happening to a person and tells them what to do before the care becomes expensive. So if you change what you do at home, rather than waiting to get so sick you go to the emergency department, that's much cheaper. And so if you're saving that money for a health economy, you're generating that value and you can get revenues for that, as well as allowing a country to deliver healthcare for its population.
Okay, so in a short vision, that it will be probably more beneficial to give the patient their data. But if we look at it in a grander vision, it's actually beneficial in the long term.
If you're taking the narrow look of how many bills can I send as a hospital, yes, giving the patient their independence is not good. If you're looking at how can I look after my population, the emergency is that you absolutely must do this.
Yeah, and I guess we can, as a country, as a nation, they can save a lot of money from that.
Correct. And it's not just money, right? It's about a person being able to live healthy for longer. That requires prevention. So that requires early detection, early behavior management. That is the point of the healthcare system.
Can you please give me a successful case study of how patient knows about help the patient?
Yes, of course. One example we had was for gastroenterology, inflammatory bowel disease. This fluctuates up and down. Most of the time you're fine, but sometimes you're not fine. And when you're not fine, you really need your doctor to be available to you. And if they're not available to you, you go for a colonoscopy or you go for a surgery. Some doctors in Surrey, in the south of England, began using this to monitor their patients, where basically they gave the patient instructions on what to do and all their data real time. And they asked the patients to put their symptoms in every day.
Okay.
And because the doctors could monitor the patient, they didn't need frequent appointments. But when they needed an appointment, they could have one instantly. And then with the symptom tracking, the doctors could check which patients were getting worse. So they brought them in for a colonoscopy, which prevents a surgery. That's an example in gastroenterology. And then we hear from patients who have cancer. It's a very difficult time in everyone's life.
Yeah.
The stress around it. Sometimes the stress is just from not knowing what's happening with your body.
Yeah.
So just having all that information makes the best use of the doctor's time for the appointment, and it just allows the patient to have control over what's happening with their health.
So basically the doctor, they can monitor the situation even from very far away.
Correct. I mean, what's interesting to me is in the Netherlands, what they're trying to do is create a learning health system. So what happens if you monitor the behavior of patients over years? And in particular, they put the side effects of the medications. And they say, well, you know what if we reduce the medication so you still get the cancer fighting, but we reduce the side effects? And the reason is if a patient can take the medication for 5 years, they are cured. But the side effects often stop them from taking it. And if they stop, then the cancer comes back. So what changes can you make over a population that get the maximum benefit for everyone? That's a learning health system. Everything's digital. You're watching people's behavior, you're watching people's outcomes. And so you iterate more quickly than traditional research. So
patient know best is actually also an educational system as well.
Correct. One of the things we do is we teach doctors how to work with patients in a way that medical schools haven't taught them. So most doctors, they leave medical school, they're being taught that they know everything. That the patient must listen to them about everything. And that's not true. Patients know a lot. Doctors only have a little bit of time to understand their patient. Healthcare is very complex. And so when a patient says to them, correct something or teaches them something, most doctors don't know how to react. And sometimes they get defensive.
Like how?
Well, they think, I'm the doctor. Are you challenging my authority, for example? All that's happened is that they haven't been taught how to do it correctly. Because really, when the patient finds a mistake for you, this is not just helpful for the patient, it's helpful for you as well. The first doctor I spoke to about this, he had a patient come in with chest pain. He thought it was a tear in the artery, sent him for a CT scan. CT scan said patient was fine. But the patient emailed him saying, what does a thyroid mean? The report, it says there's shadowing on the thyroid. That's just above your voice box here. And then the doctor realized he'd missed that sentence. And because the patient had spotted that, they brought him back. They took the sample. It was a cancer. They took out the cancer. Patient's absolutely fine. But that doctor's reaction was very unusual. He didn't get defensive. He then said, I need every patient to look at all the information with me. I cannot know everything. I'm human. And that is not how medical schools teach. So we make the system available to educational institutions so the next generation of doctors know how to cooperate with the patient, and everyone benefits rather than anyone being embarrassed about it.
Right. And also as a patient, I think it's also essential to understand your own disease, because everyone could have at a point in life that you encounter some emergency. And it's good that I know how to react when it comes, if I don't have time to run into clinic. So I think patient know best is absolutely doing a good thing.
No, thank you. The majority of healthcare spending this century is on things where what you do matters more than what your doctor does. So in the last century, most of disease is surgery or infection.
Yeah.
And we have that really well done now. So we're left with what now? Diabetes, heart disease, asthma. And those ones, what the patient does at home matters more than what the doctor does in clinic. And so you do exactly as you're saying, need to know what's your disease is, you need to know what to do about it, you need to know when to go to the emergency department. And often when you go to the emergency department, you need to tell them what they need to do for you.
I see. And my next question is, how does patient know-best ensure the platform remains accessible and user-friendly for all patients, regardless of their technical proficiencies?
In most businesses, if you can cater to 95% of the population, you're okay. Actually, healthcare is all about the 5%, who are the sickest, the least able, have the most difficulties. The system works in 22 different languages. It works for screen readers. You can change the brightness and contrast for different visual abilities. Even when we show something visually, like a bar chart of your symptoms going up and down and so on, we show the colors but we always show a size equivalent because some people are colorblind, for example. You have to think of all of these things in healthcare. So accessibility is a big part of it. And then usability in general. We try and make it work wherever the user is. So we started with the website, works on different screen sizes, but then we made it work inside the government's app. And then we made APIs so that other people are building their own apps on top. It's allowing all these different usability experiences.
How do you balance the charity part and the financial part?
It's run as a business that delivers a social benefit. It's a social enterprise. Fundamentally, what we say is the company has a mission, which is that patients know best.
Yes.
The mission is not to make money. The mission is for patients to know everything. And we do that in a number of ways. One of the things we do, for example, is the record is owned by the individual. A lot of businesses, they want to own the record because then they can sell it. We say from day one, that's the patient's property.
Yeah.
But on the flip side, that allows trust. So governments then say, okay, well, if you are operating this ethical, honorable way, then yes, let's do a contract for the whole population. We also do some pro bono activities. So we provide the system for refugee charities, for example. We also provide it for any educational institution free of charge because we would like the next generation of doctors, nurses, and so on to know how to treat patients correctly.
Yeah.
So all these things combined in that mission.
There is a very famous saying of yours, whereas tech company says, trust us, we will not misuse the data. We say, don't trust us, we cannot use the data.
Right.
Can you explain the encryption models used to ensure the data security and patient privacy?
Yes, of course. So when we started, we set up the encryption so that only the patient and the individual doctors they trusted would have the private key to decrypt the record. Now, as we scaled up so that it had to operate with tens of thousands of doctors and millions of patients, we updated the encryption so that it's available at population level and so on. We cannot do anything with it. The patient decides what happens, and everything is done transparently. So you can see who's accessed your record, when they accessed your record, what they did with your record. And we publish everything that we do on a public website. So it's part of getting trust as well as a more efficient way of working with your users, working with your customers.
That make me feel very safe. How does Patient Know Best manage the exchange of medical data among providers across different regions?
The easiest way is just if the patient has the data and they go to a different provider, they just show them their record. But we want to automate this because, when you go to a different provider, you might be arriving in the emergency room unconscious, for example, or unable to log in and give people access. So what we do is that as soon as you go to another provider, that provider sends us a message about you saying that, Mohammed is in the emergency department. And the minute you send us that information that you are treating them, you then get access to that person's record because it is implied consent that if the patient has agreed to be treated by you, then they also need you to look at their record. What we wanted to do was to give patients the power of control. But not the burden of control. So if you are sick and you are unconscious, you shouldn't be having to click and log in and authorize things. But it's trying to cover every aspect of your health, every stage of your life, every facility you might turn up to. We try to make it complete.
Is there any aspect that can be refined in the future?
It's constant. So we upgrade every week, but the pace of innovation is amazing. Yesterday I was talking to this lady. She invented an app for doing visual assessments. So, when you look at a chart and you sort of read the lines, it can help someone with Down syndrome. It can help someone with different visual abilities. And you could do it every day. So all these inventions are coming in. They're all transforming healthcare. Well, it's a constant enjoyment, but it's a constant task to upgrade the system for them.
I mean, it sounds too good to be true. Like I'm having a mini clinic inside my pocket.
That is what's happening. I have seen other devices where they use the phone's camera. So you put the camera on your finger. And not only will it detect the pulse, it will check if your heart has an arrhythmia, right? So no ECG, it will just check it from your fingers. And now they're showing me ones which can detect my hemoglobin levels from looking at my face. Again, I would never have predicted that was possible. But all these things are evolving and, people are testing them scientifically. So this is very disruptive to healthcare. You don't need to be next to your doctor for them to diagnose you. And so you can combine these devices at home with these super specialists wherever they are. And because the whole thing is digital, you can start, again, a learning health system like they were doing in the Netherlands. It's really a very interesting time in healthcare.
Incredible. You're opening a new door for me completely. And Let's move it back a little bit to your personal background. And many people start their business journey because of personal challenges and obstacles they have had in the past. And they want to help more people who had the similar difficulties like them. And obviously you're one of them, yes?
Yes.
And how did you dealing with the rare genetic immune deficiency from a young age? And as a result of your illness, you even lost some of your hearing and spent a long period of time out of school,
Yes.
which made you study independently and use a computer at home and help with your schoolwork. How did these inconvenient experiences influence your decision to pursue a career in medical?
The medical experience which I had was, I knew firsthand how important it is when you can see the right doctor to diagnose you. So it was only until I was 12, 13, the correct specialist saw what I had and knew what to do about it. And it transformed my life. So when a nurse taught me how to inject myself rather than spending a whole day in hospital, it gave me independence. I could travel, I could study, I could get married. I also realized how technology plays a part in all of this. All of that I could see it around me just from my personal experience. So when I was writing my book about giving patients their medical records, I could suddenly look back on my expertise as a doctor in a program, but also my personal experience as a patient, seeing the benefit of technology in diagnosing me and treating me, seeing the power of empowering me to look after myself, and figuring out that actually that helps the healthcare system as well as, of course, helping me. Those were kind of the backgrounds. But for medicine itself, I actually didn't go into medicine because of my illness. I went to medicine because science is what I liked, and I was trying to model the immune system. It was pursuing my scientific interest that got me into medicine.
Why did you choose medicine instead of choosing programming?
I read a book in high school called Chaos. Chaos is not only dynamics as, the butterfly in the Amazon causing a storm in Texas. The small effect, small starting, having a big ending effect.
Yeah.
And the book described all these fields that were transformed by programming, chaotic models like geology for earthquakes or economics for understanding the economy. A scientist had learned how to program to advance their science. And then it said that, of course, the body is full of chaotic systems, the heart, the immune system, and so on. But it didn't mention any doctors who learned how to program. So I thought, well, that's a gap. I will focus on medicine because they don't seem to be in. Of course, I was wrong, but that was what I thought the gap was.
You saw that blank space. The book that you just talked about, Chaos, Making a New Science, triggered my interest.
Yes.
And I would like to ask, does it share the same fundamental principle with the law of entropy? As within an isolated system, things naturally progress towards disorder and randomness if no external interference factors are involved.
It does. The ultimate expression of entropy is death, right?
Yeah.
So when your body can no longer maintain order, when entropy takes over, that's when you die. The thing is, when will you die? How will you die? What is happening to your body? Chaos is what allows you to predict that and ideally manage that. So it's identifying the randomness in the order and the disorder of entropy. That's what chaos is.
Could you please give me one or two examples of your early age experienced on impacting your later career?
Sure. I found when I, in Patients Know Best, began working with Great Ormond Street Hospital, and that was the first contract we had, and it was for children with, in their case, it was intestinal failure. They couldn't eat food through their mouth, they had to have it through the tube in their heart. These children, when they go to the emergency department, that doctor has never seen a child like that before. They don't know how to treat them. The person who does know is the mother, but they never listen to the mother. They wait and they fax to London and wait for the instructions to come back. And actually a few years later, I met a child had died while they were waiting for the instructions from the hospital. And what really made it sad is the mother had been telling them what to do. She knew exactly what to do, but they were waiting for the doctor to say it. So I experienced that early on. I was sitting with the children who were like me, and I was sitting with parents who were like my parents. So I could really see, I could feel exactly what they were going through. And I think it changed how we spoke to each other.
See, when you were at your childhood, you've lived in a lot of different places, like Yemen, Syria, Lebanon, and Cyprus. And sometimes even during the wars. How did the experience shape your perspective and drive to start Patients Know Best? And do you think you are a person who's driven by fear more than creativity regarding to your early experiences?
I think I'm driven by impatience. One thing you learn from living in different countries is that most habits are random historical. So it's not like this is the right way to do things. This is just the randomly historical way that people have done things here. And other people do things differently in other countries. So you are much faster in picking up new habits. And also, as you see everybody's habits, you can start evaluating which is the most useful habit. So you pick up, because every culture has lots of things to teach you.
Could you please give me one or two examples? What are the good habits?
Yeah, sure. So I come to England when I was 10 and I asked the teacher what a word means. And she would never give me the answer. She would give me the dictionary, which really annoyed me because I said, the dictionary is when I know the spelling of a word, I get the meaning. Why give me the dictionary? I don't know the spelling. And what the English are trying to teach you is, okay, you may not know the exact spelling, but there are 3 or 4 different possible spellings. Try them all. It only takes you 5 minutes. You should do things yourself. Arabic schools, they teach you everything rote learning. So in Arabic schools, I learned all the capital cities, all the countries, all the populations. In English schools, we never got that. In English schools, we learned how to learn. So there are 2 different styles of teaching. When you go and practice medicine in England, they are more about the physical examination, the history taking. In the USA, it's all about the technology, the CT scan, the MRI, the advanced things. So there are different ways of practicing, but you learn them from the culture.
I think there is advantages and disadvantages in both ways.
Correct.
Yeah, but the thing is you need to know when to use which.
Unfortunately, the only way you can know that is by being forced to do both. Because most people don't like doing the other way. They like doing the first way they were taught.
Yeah.
And if they only spend time in one country, they believe that is the only correct way. But when you are forced to quickly switch between the systems, you see the advantages of seeing the advantages. You've had to learn all these different ways and you discovered things out of them.
So it seems like you're very grateful about your multicultural background.
Yes, very much so.
You just said you're driven by impatience.
Yes.
Personally, I think impatience belongs to creativity.
Yes. You know, as I was getting my injections,
Yeah.
I would see people with my disease who were older than me and they didn't live very long. Or when they were a little bit older than me, they looked a lot older than me. Their body deteriorated very quickly. I was constantly aware I didn't have much time. I'm very lucky I've lived for as long as I have, but nobody expected it to happen. So for me, impatience was about how can I learn and do as much as quickly as possible in the limited time that I have.
So before Patient Know Best, you studied medicalapproach.org and handheldsfordoctors.com.
Yes.
So does it have anything related with that?
So they were separate. So what I wanted during medical school was to have medical textbooks on these things called Palm Pilots. And I asked the publishers who wrote the textbooks to give them to me. I would put them on a Palm Pilot. And they refused. They said, nobody wants them on Palm Pilot. I said, I want them on Palm Pilot. There must be other people. And I got so annoyed that I then found 4 doctors in the year above me. They were really very thoughtful, very hardworking, very patient-centered. Why don't you guys write a book and I will publish it on the Palm Pilot? They did all the work, they did all the content, and I edited it for them and then put them onto that book. And we did it, of course, we just released the whole thing so anyone can download it free of charge. So, the week after I did it, I was getting emails from a medical school in Ghana saying, we couldn't afford the normal Oxford textbook, but your one was really good. I put the whole thing on the web. Anyone can download it. They can install it on any Palm Pilot. That guy who emailed me saying, I printed 1,000 copies of your book because it's free. Other people were using it on the wards.
I mean, you could have charged people.
In the beginning, all I wanted to do was the right thing. And I didn't worry so much about being paid. Later on, I had to learn how to make money and how to charge for things. Yeah. But in the beginning, I didn't charge them anything for that work.
Actually, everything you've done in the past is not money-oriented. So you're always focusing on doing good things to people.
That's what I like. And it means, when we began hiring people in Patients Know Best, it also means being surrounded by people who think in the same way. So every one of them has that mission. Every one of them is trying to do the right thing. So working around those people it's a very pleasant experience.
I could guess that. But as a CEO, I think you also have to think about the financial perspective. And I would like to ask you, how did you convince the early investors and partners to believe in your vision?
I was not good at it. So in the early days, of course, you begin by funding it from your own savings and friends, family. And
3 Fs.
But it took us about 4 years to get our first angel round. Before then, we were just getting people putting in 20,000, 30,000 because nobody believed it was possible.
How did you insist for 4 years?
So part of it is you don't take a salary yourself. That the most important investor in the beginning is having a good partner. My wife, she was working when I was getting no salary. What I realized that in healthcare, the problem is decisions are small and slow. So you have to find a way of spending very little money for a long time to prove that the thing works. Once you do, healthcare is enormously scalable, but you have to survive those early years. So in the early years, we just found ways of operating at very small sums of money. Working from home, for example, but it was very difficult.
I see. I guess you would just have to find a very rare and special investor who has a grand vision rather than other investors in this world. They probably just focus more on instant feedback.
Correct. I mean, the way we raised that angel round was from the London Business School. By the way, I pitched them 3 times. The second time I pitched, my co-founder was there. He'd raised 100 million for previous companies. And he wanted me to know, A, this was the worst pitch he'd ever seen. And he said to me, it's because you've been trying to explain yourself to so many different audiences, trying to explain different ways. It didn't make sense. He said, just tell what you want, what you do. And if somebody likes it, great. And if they don't, also fine. Stop trying to change the story.
Yeah, because I think when it comes to investing, your personal charisma actually counts as a very big part in it. But also, at the meantime, you have to have something solid.
Yes.
And you picked the right partner.
So when I came back to Cambridge to start the company, I met up with someone from Cambridge Network, which helps companies and employees and the university work together.
Yeah.
And I told him about my idea, and he said, I like you, you seem like a nice person, but you need help. And there's a guy called Ian who's just left his current company. You should talk to him. What I found interesting about Ian is everybody who I spoke to for advice would say, yes, I can give you advice. How much equity will you give, or how much will you pay? Ian didn't do that. Ian, first of all, said, let's figure out what it is, and then we can figure out what share of it there might be. So he helped me write the first business plan at no cost. And then for some reason, he spent over a 4-month period teaching me accounting. So it's about knowing every part of the business as you start. But he spent 4 months doing that, no expectation of money. He just wanted me to learn. So people like that, they're very good co-founders. They're thinking about the long term and doing the right thing, not about the short term or what share of the pie they can take.
Do you remember how did you feel after London Business School said yes to you?
I was very, very relieved. Because for the first 4 years, every 2 or 3 months we'd have a financial crisis. This was the first time we had a good bit of funding in 2012.
Very in center of your personal journey.
I remember when we got that first contract, I'm very stressed because every one of those people has a family and you have to have enough money for their salaries.
You're carrying a responsibility every day, which I think being an entrepreneur is hard because you are carrying a lot of responsibility, not just yourself, and you just have to keep running. This is not a machine that you can stop at a minute.
It is. So one thing I did learn over time is actually a lot of the other people want and do and can help.
Yeah.
But a lot of the time in the beginning, you think you have to, only you can do it, only you can think about it. But then as the team grows, you realize they're all highly motivated. They all want to do the right thing.
Yeah. Because as a freelancer, if you don't like the job, you can just I don't want to do it. But as entrepreneur, CEO, no matter how you feel, you still have to just get out and get the work done because people are relying on you.
Especially in the early days, it wasn't just the colleagues. It was I'd looked doctors in the eye, and I'd sat with those children and their parents who were relying on the system for their medical records. It had to work.
I think it's a great thing. And some major companies in the USA, like Microsoft or Facebook, have tried similar things, and they invested lots of money and they failed because of restrictions in the USA. And if you want to enter US the next year, how are you going to be different? So, and remember, I started Patient Invest in 2008 based on research in 2007, which included watching Microsoft and Google who launched that year. So I interviewed the CTO of Google and the CTO of Microsoft about their product. What did they say?
So I got to see all the problems in the early version of the product, as well as understand the benefit. So I actually spent a year working with US hospitals, asking the US hospitals to use Microsoft and Google, because I, as a patient, knew this was really powerful. But that's when I realized the US hospitals were going to bankrupt anyone trying to do this in the USA. They did not want, because the minute the data goes to Microsoft or Google with the patient, the consumer can then take it to another hospital. And the US hospitals did not want that freedom of movement. And so what they were marketing as their hospital portals, they were saying this is how consumer friendly they are. They were actually using it as customer lock-in. They would lock the patient into that hospital. So I then realized we couldn't start in the USA. We had to start in a country which would not be hostile. And the best one I could find was the UK. So again, going back to living in different countries, I understood about different systems and so on. And the UK with the National Health Service had a different business model and a different culture for starting. So when do we come back to the USA? Well, I've been watching them every year on how the healthcare system changes. There have been bits of legislation 2 years ago that meant there's more freedom to operate, but the business model is they're still trying to lock in. So I would approach it in two different ways. One is you go down the research area where you work with hospitals, with rare diseases and researchers, where the benefit of the freedom of movement of data for research purposes outweighs the worry of the hospital's finance team about loss of revenue. They will get more of a benefit. So that's one way to begin. And the other way is to go for small states. Those are often the pioneers in new technology in healthcare because they could make an agreement at a small scale. Whereas if you go to California or New York, it takes too long to do that.
For instance?
So if you go to a Hawaii or a Connecticut, those small states, you could make a deal with central government there saying what we've done in England, would you like it to be done in your state? And that's how you begin.
And you mentioned you want to expand your market this year in Saudi Arabia.
Yes.
Are you just going to replicate the system?
In a faster way. Saudi Arabia has their own national app, like England does with the NHS app. And because we worked with the English government to expand the app and give it a lot more functionality while maintaining it's the NHS app, it's the government's app. We're saying the same thing to the government there and saying, we can give you more innovation while you maintain the ownership and the government governance in the country. We're trying to do the same thing, but much, much faster. So in England, we started with a department, then a hospital, then a region, and eventually we got to a nation. We were just going straight to ministries of health now and saying, why don't we get this right for the country from day one?
And what are the potential growths in the Saudi Arabia app market?
Saudi Arabia is the largest market in the Middle East. It's also very ambitious and they make long-term plans and stick to them. So they don't change with fashions. They also do make buying decisions. The Saudis are making big decisions. What they want is whatever they prove in Saudi Arabia, they want to then scale up and export in other countries. They have a number of examples of having done that. It's a good country to operate in.
It sounds like Saudi Arabia care about their citizens' well-being very much.
They do. They've had a very long term. If you look at education levels, healthcare levels, housing levels, and so on, they've always made sure to cover their citizens.
Yeah, and also they're one of the most richest country in this world. People
understand Saudi Arabia's wealth in terms of the oil, obviously, but they have so much oil that they haven't even looked at the other assets that they have. So not just minerals under the desert, they have quite large farming areas. Huge amounts of water underground, solar, huge amounts of space on which to put solar. They have a lot of assets in that country. And they're only in the last few years being strategic about making use of them.
And I would like to ask, is there any milestones have you achieved in terms of revenue and funding that you would like to share with the future investor and VCs?
Sure. The main milestones we talk about is the amount of data that we have and the functionality to bring in a lot more data. And the reason I mention that is that then allows a whole bunch of new markets to be possible. So at the moment, we have 25% of the UK's hospitals under contract. They send us 20 million test results every month. They register 100,000 people every month. So it's a very sizable infrastructure that is attractive to other governments that will be. So we're going to different ministries of health and saying, let's do in your country what we've already done in England. But in the next few months, we're also rolling out functionality where we will bring the data to the patient, even if they're not with a customer. So even if they're not with one of our 25% of the UK's hospitals, anywhere in England, we will immediately bring the record to that patient. And then we will bring understanding to that patient. So we will say to them, you're currently on this medication for this disease, and the software can tell that it's not working. You should be on this other medication, which is more expensive, but the government wants you to be on it because it's cheaper than having a stroke. So it's working with patients to bring their medical knowledge. We can improve their health.
Mm-hmm.
And the other aspect is to say to them, I see that you have prostate cancer and you're this age and this ethnicity. Your local university would like to do research to cure prostate cancer. Are you interested? And if the patient is interested, they can contact the university. So you can facilitate research. There's also device manufacturers who would put the whole medical record onto the device, making the smartphone much more useful. So there's all these different ways of making the medical record useful for the healthcare system, for the researchers, for the device industries. And all these generate commercial possibilities.
Is prostate cancer also detectable at the prior stage?
So there are some tests that are coming out that you could detect in advance. But a lot of these trials are, once your doctor has diagnosed you with prostate cancer, what is the medication that maximizes your chance of recovery or that reduces the need for surgery or chemotherapy and so on? So there's other ones that are about predicting it before you even get diagnosed. I'm not in that advanced stage yet, so first of all, we'll do these ones.
I see. And how many users are there for Patient Know Best? Is that shareable?
No, we have 4.2 million users right now, and we add 100,000 every month.
That's a lot. I mean, that's going to be very, very valuable for the investors.
Yes, you're basically reaching people at country scale.
How did you sustain such a high growth rate?
Our big decision came during COVID when we integrated with the NHS app. Because during COVID, the NHS app had the COVID passport, everybody began using the NHS app. And then we expanded the NHS app with lots of functionality, so people find us in the app. 100,000 of them every month.
So it's all organic growth?
Correct. People find us in the NHS app. It's people finding us, so rather than advertising saying to them, go and do this, they're already doing something. We are where they are.
Yeah. What future innovations or development do you foresee in the healthcare technology space that excites you the most?
I think it's application of smartphones for behaviour change. We already know from Facebook and Instagram that your phone is able to change your behaviour. Imagine if it was changing your behaviour for something good. So it could intervene around your diet, your exercise, your daily habits. That is the behaviour change that we need in healthcare.
And we still have a very long way to go.
It's a long way to go, but it's also the speed is quite, literally every week I find an app. I think I didn't know that was possible.
We're on the fast lane.
Yes, correct.
Well, everybody, Patient Know Best. Thank you so much, Mohammed. Thank you so much for coming. Thank you.